I was in the hospital for about 24 hours, even though I have broken bones, because some of the staff warned me that I wanted to get out of there as soon as possible. Because I live near one of the best trauma centers in the state, but that also means it's one of the most expensive hospitals to stay in. And I have private health insurance, but when I looked at the policy, they cap out their payments at $400 a day for the room and $400 a day for services. So with that first night of emergency care and CAT scans and x-rays, we're probably talking 10, 15, or 20,000, and $800 off doesn't make a dent in that. So when the staff member said, hey, I know you're hurt and I know this is a struggle, but if I were you, I would get out of here as soon as possible unless you have the absolute best insurance in the world. And the first time PT got me up to walk with a walker, I could barely make it to the door. And I had tears in my eyes and I was gritting my teeth and I was like, oh, this is going to suck. But what I realized is it was going to suck at home or it was going to suck at the hospital, and it was going to be a lot more expensive to suck at the hospital. And I'm really grateful for the friends who have showed up and stayed with me and helped me cook and helped me clean. Somebody from the co-working space stayed last night. We've got friends from the West Coast and even friends from Canada talking about coming down to stay with me. It's been amazing. And it's really hard because I struggle to ask for help. But that first night at home, I couldn't get into bed. I couldn't roll over in bed. I couldn't get out of bed. I needed help emptying the urinal jug. There were so many things I needed help with. Even though the bones haven't healed, the muscles around my torso and my pelvis seem to be relaxing a little bit, because that's where the majority of the problem was. There was a lot of pain, but they would lock up or spasm, or I would just shooting pain when I tried to move, and those are getting better. Even so, I'm still going to need a lot of help because I really can't carry anything. I've got clothes in the dryer that I need to get out and fold. They're just things I can't do at this moment. And I am reminded just how lucky I am to have people willing to take the time and step up for me. Because I imagine somebody being in that situation where you say, hey, do you want to go $20,000 more into debt, or do you want to go home and have nobody there to help you? Because I consider myself a pretty tough and self-reliant guy, but that first night, if I hadn't had help, I know I would still be laying in that bed covered in my own filth. And at least I was responsible for my own accident. I put myself there, so I can own that and I can know that it was my fault. When I think about all the people who end up in the hospital not by an action of their own and are still struggling to figure out how they're going to pay for it, or what they're going to do until the lawsuit gets settled, or what they're going to do if insurance tries to stiff them, it's such a difficult situation. Even with the debt and the pain and the struggle of doing daily things, I have so many things to be grateful for amazing hospital staff, for amazing friends, and for being in a situation where I'm going to heal, because that could have been a wreck that I didn't walk away from.